Obama is trying to move on, legislatively move on. He renewed calls, as we watched there, another part of his agenda on immigration reform in just the last 10 minutes there, saying that he really has nothing to lose because he doesn't have to worry about getting reelected again. You know, but there are really serious questions by oversight to be asked about Obamacare's website and Obamacare 2.0's website patches and fixes to streamline what Americans have said that they want. They want affordable, accessible health care. But the question remains, can House Republicans who despise Obamacare drop the drama and ask fact-based questions to make it better, or will they act happier than pigs in slop, gloating over a glitchy rollout? Joining me now is Democratic New York Congressman Charlie Rangel, chairman of the House Ways and Means Committee. Sir, it's good to have you here, and let's dive in on this, because a lot going on in Washington, and as we know, there are serious questions to be asked about what took place with the website. Contractors being in the hot seat today. Next week, we have Secretary Sebelius, but the contractors are saying there was no way to test the kind of deluge that they received from Americans that were interested, and then we get an essentially don't blame us kind of response. But colleagues of yours are calling for consequences. We have Representative Becerra saying somebody should be held accountable. Representative Nolan saying President Obama needed to man up. Senator Bill Nelson saying it's inexcusable, somebody ought to be fired. And Representative Sean Patrick Maloney saying I'd like to see somebody lose their job on this. And this is what you had to say on our air, that this was like a pimple on an elephant's backside. And you were quoted as saying it's screwed up. So who deserves the blame here?
Blame? We have tens of thousands of people that are trying to get health care. And we had hoped that it would be much smoother for them to apply. That didn't work. It didn't work with Social Security the first time it was rolled out. It didn't work with Medicare the first time it was rolled out. President Bush, Section D for prescription drugs. You know, I just can't believe that the Republicans have this obsession to destroy a plan that would provide health care. So this is a glitch. I'm not belittling it. I wish we didn't have it. But my God, we got until the end of March to straighten out these things. And I never thought when I went to Congress over 40 years ago that my biggest problem with health care was taking care of the overwhelming number of people who are either under or uninsured.
Well, or the advent of the internet would be what's standing in the way of it.